Still nothing rains on healthcare reform parades like dollars, or in this case, the lack of dollars. Deficits as far as the eye can see for as long as we can see. But don't blame my next guest if he stops you right there, because he's heard the argument before about deficits that wouldn't end, and then suddenly they did, and surpluses that would last forever, and suddenly they did not. Here's Miles Rapoport. He is the president of DMOS. It's a big think tank. They all think there. They're very, very thoughtful folks. Miles, good to have you.
Thank you, Neil.
And you know, it's funny, reading what you said, I agree with you. We get trapped in the moment and we assume that the present press is accurate. And it wasn't all that long ago that we assumed, you know, the surpluses would last, and they didn't. And now we're saying that these deficits are going to go on forever, and we might be overshooting things. What's the middle ground?
Well, I think the economy is in a very volatile state. That's very clear. The sharp drop in the Great Recession, and now the slow rise, and we can't really foresee the future. I think accurately projecting deficits 10 years out, much less 20 or 30 years out, is a very, very difficult business. What we can say is that in the short term, the deficit spending that the Obama administration and Congress have done on the stimulus package, on the cash for clunkers, on extending unemployment benefits, those kinds of things have clearly helped to pull the economy out of the recession, and were absolutely necessary.
All right, now, so the long-term forecast, so there's 8 or 9 or 10 trillion or 20 trillion, whatever you want to say, we pile on, right? When we fear the government spending too much, you think that these 10-year forecasts that just tend to make it worse and worse and worse are overstating it? Is there a middle ground you suspect, or is that depends on the snapshot, right?
Well, two things. They may be overstating it. Obviously, if the economic growth comes back, tax receipts increase, the amount that the government has to spend on the automatic stabilizers, unemployment,
right,
food stamps, that declines, and growth can really help the deficit picture. So
but can that do enough to balance out all the money that's been spent?
It won't balance it out, but that's the other point. I think that running a deficit, even over the long term, is not necessarily bad economics. If, in fact, the money is used for investing in things that in the long run are going to help us, the development of a green jobs economy, education, community colleges, making college more affordable, healthcare reform even. I think those are worthwhile investments. But it's got to be reform
that is real reform and exacts real savings. Do you buy some of the savings estimates we're getting for a program that's not even implemented and whose details aren't even known?
Well, it's impossible to say what the savings are going to be or what the reform is going to be.
Well, they're already doing it.
What we can say, though, is that the United States, as a percentage of our GDP, spends far more than almost any other country. And if you actually said, okay, we can get that down from the 16% that we're spending now, down much lower than that.
Well, that assumes with this we can.
If you can.
So we have to in order to just...
We have to do reform. Okay. We have to do reform. Otherwise,
has the government ever done that effectively?
I think Medicare has been a pretty effective delivery system for health care. My father swore by it, and the administrative costs were low. I think it is possible. I think
Miles,
if you
I
get some of the
disagree there. You might be right in terms of the grand scheme of things and how it afforded, you know, adequate health care for a lot of folks. That started out as a $65 million program in 1965, and now we're talking about a $400 billion program paying $5 trillion plus in benefits. So I guess what I'm saying is when the government steps in, it just gets bigger and bigger and bigger and bigger, right?
Well, we've got an aging population. The number of people over 65 is far more now. That's
right,
a huge
but that's
piece
a given for
the cost of all the health care. It's going to escalate. It's going to escalate, absolutely. But the way
you're saying the
Medicare,
deficits and the fear that we have is overstated. So you're kind of in Krugman's camp there.
I'm in Krugman's camp, yes. I think that the short-term
deficits are clearly... Does it strike you as odd that Krugman didn't say this when George Bush was president? So we weren't spending differently then? Was that it? Spending on these domestic initiatives is better than what he was spending on, essentially is what he's saying, right?
Well, that's certainly an argument to be made. I would argue, though, that if you actually are focusing on the issue of deficits, long-term deficit, if it's spent wisely in things that encourage economic growth and help people over the long term, that's a good use of our money, and it won't hurt us in the long run. If it gets too high,
I hope you're right, all I'm noticing,
but not so.
I don't know enough about your past, but I know enough about Krugman that with Ronald Reagan, George Bush Sr., with the last president, deficits blasted them constantly. This guy gets in, now deficits don't matter. I'm just saying what's good for the goose should be good for the economic gander, right?
Right.
So you think he's being a tad disingenuous here?
Well, I don't know everything. You have to go back and see everything he said in the last segment, in the last administration. But I do think that the basic notion that we ought to invest, we ought to have a huge program to help states. I come from Connecticut. That state is in huge crisis. Can't have a budget. We're 3 months behind in budgeting. If the states had money, they wouldn't have to raise taxes or cut spending or lay people off.
All right.
That's a very good use of money, and we ought to try to do it.
We'll look into that. I want to get you back to talk about those other aspects. Great guest, Mas. Thank you very, very much.
Thank you. Glad to be here.
In the meantime, Scott Minerd says